to the system. Well, let's discuss all those figures with Dr. Layla McCay. She's the director of the NHS Confederation, the membership body for organisations that commission and provide NHS services. Hello, good afternoon.
Good afternoon.
I mean, a huge difference across so many areas compared to the same period last year. What is your overall thoughts about, well, the state of the NHS, but the situation facing people who need treatment away from coronavirus?
I think that what we're finding ourselves in at the moment is a really tricky situation. Our members, whether they're CEOs of hospitals, whether they're GPs, whether they're clinical commissioners, they're telling us that it's in many ways easier to have discontinued or paused treatments in order to really scale up that coronavirus services. But actually, it's a bit trickier to turn the other services back on again, especially as they need to keep preparing in case there is a second wave of coronavirus. So it's a challenging time. And I think that it comes as no surprise to anyone to see that there have been fewer operations and such like done during that time. I think the big focus now is on how to increase that.
Well, absolutely. I mean, you say a challenging time, but that is, and people will understand why, but that is also hugely dispiriting. If you are in, for example, excruciating pain because you have been waiting months for, let's say, a hip replacement, and you're thinking, well, when is this going to get done? I mean, there is a massive quality of life issue around operations such as that.
Absolutely. It's a real concern, and it is really at the forefront of the minds of the leaders of NHS organisations at the moment, really looking at what they need to be able to provide more services. So whether that's financial support, whether it's logistical support, whether it's using the independent sector resources to be able to deliver some of that care in environments where people are not COVID positive. It's a very tricky scenario because you really need to be able to keep people who are having these operations, etc. You need to keep them away from people who are COVID positive, and that's a really tricky situation to be in. And it's why there's this real reduction that we're seeing in capacity at the moment.
How much concern do you have about the messaging that has been going out over the last few months? I'm thinking of people who have had other health issues, everything we know about that doesn't stop because of coronavirus, strokes, heart attacks, possible cancer, who have felt that they couldn't go to a medic of any kind and have not come forward. And that is worrying for a lot of diseases. How do you think that the message could and should have been clearer? And do you want to try and make it clearer going forward?
I think the message needs to be that you're not going to stop developing cancer or having a heart attack just because there's a pandemic. If you have symptoms that you're worried about, you should go and seek help for those symptoms. The NHS is open for business and ready to help you. And I think that everyone is really quite concerned, particularly about the drop in people coming into A&E. Like, where is that extra third of people? Are they suffering at home? So really, we need to have a big focus here on making sure that the people who need care, and especially the people who need care urgently, they get that care. So there have been so many infection control systems put in place to make sure that you can get that care safely. And a lot of people have devoted a lot of time and effort and resources to making sure that that's the case.
So if the country is faced with a second spike later in the year, can you say to people who are watching this, who are, let's say, still waiting for what would be considered a routine operation, can you say to them that I promise you there is planning underway, that your trust is doing the best it can to try to get you through that operation as soon as possible, despite what might be coming down the tracks?
Every NHS organisation is focused on how to deliver the care that people need, both the coronavirus care and all the other care that people need. They know that you're there, they've not forgotten about you. They are planning and examining the options and coming up with ways to make sure that that people get the care that they need. But at the same time, we also need to remember this is such a difficult time. The staff are exhausted. The system has less capacity than it usually does. it's really difficult. So at the same time as saying we are all focusing on making sure that people get the care they need, there also is a certain need to have realistic expectations, because this has been such a hard time and we're coming out of it, but we don't even know whether we're out of it yet. We need to be ready in case there is a second wave.